and I'll explain what we're doing. So your YouTube is what you said, at King's.
So my YouTube is King Spade. It's
King Spade.
Yeah, King Spade. Yeah.
King
And
Spade.
then my
Alright, cool.
TikTok is just King Spade YT, but it's gonna be changed to either bodybuilding. Well, yeah, power
building.
Power building, and
Like
then
that.
underscore is like Steve just lifts.
All right, so you can hit a little start action. All right, cool.
Yeah.
So Dr. Nick here, Muscle Fix Mobile with the one and only Steve. This guy's really, really cool and interesting. He is a power builder.
Yeah.
I love it, love it. So here we are, Sunday morning, sunrise. Had a little shoulder injury, a little rotator cuff injury. So we're doing a little cupping and scraping. So tell me how it feels, Steve.
At first, like, it was like I felt the little pinch from the suction cup, but then it's starting to feel a lot better when you're doing I don't know what tool that is, but like you're going back and forth. That feels really good. I started to feel the tenderness too.
Scraping tool. So this is called Factor. This was created for, you would appreciate this, and by U.S. Olympic athletes. Dr. Tom Hyde, who was a power lifter for the U.S., for our country.
Yeah.
So he's a chiropractor and created this technique and modality to do treatment actively and interactively, meaning the next part of this is we're gonna do your treatment while we rehab, while we stretch you, and while we mobilize you.
Cool.
So the idea of Factor and the technique we're doing here with the cupping is we're doing a little treatment first passively, just to break up the scar tissue and the knots. Now, you did have a little bit of an injury in the gym, so my job is to get you back in there as quickly as possible so we could continue training. So again, with Muscle Fix Mobile, we want to fix muscles mobily to get back in the gym and training. So my job is to keep our clients, our followers, our patients as strong and healthy and in the gym as much as possible. So when we have a shoulder injury, we're going to talk about modifications and a little bit of tweaking your training a little bit, because I do want you to continue training. However, again, with an active injury, we do have to respect the injury and the healing process, because as a young man and power builder, we want to make sure we give this appropriate time to heal, because if not, a lot of these shoulder injuries I've seen, you're a young man, can be career ending and really, you could really get hurt, and obviously we don't want this to be like a surgical issue. So we'll kind of keep it rolling and see how you feel afterwards. So my question to you is, on a 0 to 10 scale in the last 4 or 5 days, I guess, what's your average pain level outside the gym and in the gym in your shoulder?
Before it was definitely like touching like the 7/8, like all the time. After I got used to it, and maybe it's getting better and everything like that. It's only when I do my heavy bench days.
Got it.
On the flat bench.
Got it. And a 7 or 8 out of 10 pain for a power builder is a lot of pain.
Yeah.
This guy doesn't seem to be a complainer about pain. So, it's interesting, doing this a long time as a physical therapist, people usually don't complain about pain and say, man, something is kind of wrong in there. So when a strong guy or woman complains to me and says, hey, Dr. Nick, like, I got some pain in my shoulder, my back. That's why Muscle Fix Mobile was created, strictly for the gym crowd, to be honest with you. Because again, I value movement and true healthcare as a physical therapist in the gym, right? So if we stay in there and you're doing your thing with power building and movement and really helping others that way, I want to thank you and your platform for doing that, because really, really, really is important to stay strong, which means we'll stay healthy. So I want to make sure, your followers and influencers that are following you, that really, really understand the importance of this. It's not just an aesthetic thing. It really, truly is staying healthy, well, and strong, which is awesome, awesome, awesome. So I love the power building concept and ideas. So I think it's going to be super, super cool. Now, another thing we're doing here is called dynamic cupping, which we have our 3 static cups on here. And then we're also doing a little dynamic cupping, which means movement. And you can almost feel like those little bumps in the road. I don't know if you felt that before when I was scraping.
Yeah.
But what we're scraping actually is superficial surgery. So on the skin, we're not penetrating through skin, but we're just doing superficial surgery, which means we can break up the scar tissue, right? So we don't need to cut the skin and do surgery and be out of commission for a few months. So again, as I told you before, if you had an MRI today and you're like, hey, Dr. Nick, I do have an active tear, then we need to actively start treating this, right? So I do, we do take like emergency calls, you tweak it in the gym or whatever, playing sports. I've seen it all. It's just another story of how people got injured. Now, ultimately, my job, as is your job, is to do a lot of preventative medicine, right? So ultimately, my goal with you and anybody that values fitness and training is to stay on a maintenance program. So most of my patients, every 6 weeks, 8 weeks, whatever it is, we do what we call a tune-up or a body part of the month. So most people would say, well, hey, Dr. Nick, is it bad to do treatment or cupping if I'm not injured? If you're LeBron James and Steph Curry, guess what? They get this done every day. So why are all the cool kids in these